My name is David Gusick. My organization is called Somebody to Talk To. It's a 501c3 organization, and our goal is to help educate patients and caregivers about how to be better patients and caregivers. We deal with families that are dealing with rare chronic diseases. Life is difficult enough as it is, with work and relationships and life not going the way you'd like it to go. And when you throw in a rare chronic disease, it can be overwhelming for the vast majority of patients, especially since many of these are life-threatening. And there's a lot to unpack when people start coming to terms with either their own mortality or somebody that they love. And because these things are rare diseases, they have nobody to talk to. And now we give them somebody to talk to, hence the name of the organization. As opposed to being a webinar where you could bring in an expert and they could talk about clinical trials, or they could talk about grieving or stages of grief. We try to let the people speak. Anybody who comes to a session will have an opportunity to share their experience with the group and feel like they're part of a group. Again, because if you have a rare disease, chances are in the community you live in, there's nobody else who has a rare disease, the same rare disease. So this gives people an opportunity to spend some time with other people who are going through similar life challenges and commiserate, celebrate, and connect with others so they don't feel so isolated. And really, all of our topics come from conversations. We listen to the conversation, we record the conversation, we go back and we listen to it, and the needs are self-evident. So typically we work with other organizations, so we'll work with a patient advocacy organization, and we try to leverage their community and their connections with the community, and then we can bring the expertise on bringing these sessions to their community. And we've got kind of like a cadre of phenomenal presenters. Many of them are psychotherapists, many of them are TED Talk people. Each community is unique, so what worked for Duchenne might not work for sickle cell, right? So it's like a custom tailored suit. We know what needs to be taught. Some things are universal. You know, navigating an ER visit is universal in the sense that if you've got a chronic disease, there's a good chance you're going to have to go to the ER at some point, and you don't want to learn about how to navigate the ER when you're in the ER. So if we can prepare you in advance, you're that much better off. Long term, I would love to see every rare disease community have a program like Somebody to Talk To, so that from the minute they get the diagnosis, they could say, you get diagnosed on a Monday, hey, there's a session Monday night, why don't you go learn a little bit more about this disease that you've just been diagnosed with? Because a lot of people, they kind of go into shock and they go into denial, and time is of the essence, and interventions work best when they're implemented as quickly as possible. I think that every rare disease could benefit from this program, and you don't even have to have a rare disease to benefit from this program. It really is about how to be a better parent, how to be a better spouse, how to be a better communicator, how to articulate your needs. It has to do with my son and a little bit of a crisis that he was going through when he was finishing up high school. I went through a similar crisis when I was finishing up high school. I think when people are closing one chapter and opening another chapter, it's a time of great risk. There's a lot of uncertainty, and I think a lot of people can get overwhelmed, can go into a depression, and once somebody's in a state of crisis, it's too late. It's 10 times more difficult to bring somebody out of a clinical depression than it is when they're on the path. Our mental health system is reactive. Early intervention is better than after we're in crisis. So that was the impetus. We can prepare people. Everyone's going to face adversity at some point in their life, right? Nobody's immune from it. Doesn't matter how rich you are, how famous you are, how many friends you have. Death, disease, like, you will be impacted by losing somebody you love. And the question is, when you get knocked down, can you get yourself back up? And without the proper support system, it's a lot more difficult. So we'll do a session on how to build a support network so that when a crisis strikes, you're prepared for it. This came from the Duchenne muscular dystrophy community. So I've met hundreds of Duchenne parents, and I would say 90 to 95% of them are overwhelmed to the point of being debilitated. And there's varying degrees. But you get these rare examples of people, parents, and children who have the disease, and the families that are thriving. And you kind of say to yourself, why is this 5% different than the other 95%? So what is it that these small percentage of people are doing? And then let's use them as role models, right? And I think that's an important part of what we do, is pulling people from the community who are role models. Because if I don't have a role model, who do I know where do I learn best practices? So the three factors that I've seen, one is access to money, right? And you'll see this across all these rare diseases. They'll start a foundation. My child gets sick. Some of them even start pharmaceutical companies, biopharmaceutical companies. I've even seen that in the Duchenne space. So an amazing woman, she and her husband, they got the diagnosis. They were living in London, and within a couple of weeks of diagnosis, I'd say within less than a month of diagnosis, they dropped everything that they were doing, moved to Boston because that was the epicenter of biomedical research, and they said, we're going to dedicate our lives to finding a cure to Duchenne muscular dystrophy. They said immediately, how can we move the needle on Duchenne muscular dystrophy? And they mapped out the landscape. They said, this is where we think we could do the most help. They came from financial backgrounds. They had no experience in biomedical research. They used their connections. They raised $17 million. Then they went on and raised more, and now they've got products in clinical trials. The second thing is a strong family unit, and that's where, unfortunately, with a lot of these rare diseases, single mothers bear the brunt. And I think one of our goals is that if we can keep the family unit intact in a healthy way, that's going to get the best outcomes for the patients. Having a strong family unit is so important. And again, isolation is the enemy. Human connection is maybe not the cure, but it's an important aspect of it. So we really will do things like marriage support sessions, parenting skills sessions, how to settle an argument. You know, the third one is, it's a little kind of like an X factor, and it's just like, some people are resilient and they're born that way, and they're optimists, and they grew up optimists, and maybe their siblings didn't. I don't think it's genetic. It's genetic in the sense that you're born this way, but who knows why? And it's those people that see the best in people, that see the best in themselves, that are willing to put themselves out there and go with it. And those are the people that I love the most, because it reaffirms your faith in humanity, that there are these amazing superheroes out there that are unsung, and nobody would even know the lengths that they go for their children, that they go to their families, and it's thankless. Nobody pats them on the back, right? So those are the three things that I think. I just know that people are in pain, and I think the medical community is ignoring one of the biggest contributors to illness. You know, it's that I think like 45% of all medical visits are stress related, and you see these companies that are here and they're trying to create a magic pill to address myasthenia gravis or whatever. And what they're doing is brilliant, right? These gene therapies, they're curing things like sickle cell, which is phenomenal. Basic things, health, like nutrition, exercise, sleep. Like, there are so many contributing factors to these diseases that don't cost anything. And if you could teach people good sleep habits, good eating habits, even if your disease is completely unrelated, if people started taking more proactive care of their health, their mental and emotional and physical health, you wouldn't need a lot of these things.